All right. Hello, everyone, and thank you for attending this open lecture. My name is Brooke Vansickle, and I graduated from the program in July 2020, and I'm currently working as a course assistant for this year's cohort. Feel free to submit any questions that you may have related to the lecture, the program, or admissions via the Q&A function. It is my honor to introduce Dr. Laura Schmidt, who is the professor of health policy in the School of Medicine at UCSF and teaches the Global Health Policy course.
Thanks, Brooke, and it's great to be with you all today. I'll briefly kind of give you a little background on who I am and what I do. I live in a funny niche within the university where we try to translate evidence from scientific evidence into usable forms for policymaking and essentially evidence-based policymaking. And I got my start working in the alcohol field, doing addiction research, and a little over a decade ago pivoted to start looking at obesity and diabetes as it increases worldwide, and to apply some of what we know from alcohol and tobacco research to the area in particular of soda and sugar sweetened beverages. So Brooke, you're going to advance slides, I think. Okay, so let's go. Next slide. So one of the things that is really important to appreciate about food policy is the size, scope, and scale of the industry, the food and beverage industry. It's really transnational corporations, just a handful, as you can see from this slide, that dominate the food supply worldwide. As hyper-processed and sugar-sweetened beverages and other hyper-processed foods start to become less popular in developed countries, these companies have been really exporting their products into low and middle income countries. And this is a key factor in why we see rising rates of obesity and diabetes and other cardiometabolic diseases worldwide. Next slide. So one of the areas that I work in is in the area of commercial determinants of health. And within that area, corporate political activities are a really important thing to understand. These are strategies used by corporations to shape government policies in ways that are perceived to be favorable to business interests. And so we try to understand corporate political activities so that we can monitor what these large health harming industries are doing with policy and politics, and try to influence and support policymakers to weigh in on the side of public health. These debates over food policy unfold at all different levels of governance within our system, all the way from cities to nation states to regions of the world, all the way up to global institution of governance like the UN. And a lot of what these companies are up to at the global level is trying to suppress and stall the diffusion of public health best practices that involve industry regulations. And so they want to keep all of the rules of the game private. They don't want governments telling industry what it can and can't sell within a particular area or jurisdiction. And one of the challenges with this whole area is that the political arena in which these debates, whether it's tobacco, fossil fuel, or hyper-processed foods, they unfold in an imbalanced political arena where the size, as I just showed you, of these companies and their global reach just daunts what stakeholders on the ground in public health advocates can do to counterbalance that power. Next slide. So this is just one of many ways to understand corporate political activities. And we're trying to really unpack how these industries function as if they were just like mosquitoes, a vector of disease, and really understand what goes on behind the scenes so that we can predict what they're going to do next and support public health policymaking. So this is just a simplified version. It's a very complex area, but one of the things they do is they try to influence the evidence base by funding research and trying to cast doubt upon whether, say, their products are viewed as addictive or harmful to health. They fund partnerships. We currently have a big debate going on right today in Georgia. Coca-Cola has been bankrolling politicians who are behind voter suppression laws. And so these companies are in the middle of many, many political debates, and through their funding, they like to be at the table. They like laws. The WHO just finally told the food industry that their lobbyists are not welcome at the table, the World Health Organization, but they really try to get inside the policy debates. And they also are very good at framing the debate. And one of their generic strategies is to view all health harms associated with their products to be an issue of individual choice. That if you don't want to eat unhealthy things, you should just decide not to eat them, and so forth. So they're very good at framing debates to deflect attention off of industry practices that are not supportive of health. Next slide. So a lot of what we know about how to regulate health harming industries comes from a very successful war on tobacco. This is a picture from 1994 when all of these CEOs and executives from the tobacco companies stood up in front of Congress and swore that their products are not harmful to health. Despite this, and particularly scientists in the Tobacco Center at UCSF, we're looking behind the veil at industry documents, at previously secret documents that were disclosed by reporters and through lawsuits, where these guys were constantly talking about how their products harm health. So there was this war of information. And this is a strategy and an approach that most health harming industries take. Next slide. So here's the reason that we take the script out of the tobacco wars. You can see here that as per capita cigarette consumption declined in the US starting in about 1965 with the Surgeon General's report, you can see fairly soon after you see this plummeting in the lung cancer rate. So this is this major success story in public health that we want to replicate as much as we can. Next slide. So what worked with tobacco was, first of all, courageous public health officials and researchers spoke out against the industry. They started actually questioning whether these guys, when they swear that their products don't harm health, whether they're serious about that, and started to study the industry. And a lot of the leadership in the tobacco fight came through the UCSF Tobacco Center. And then there was this sort of virtuous cycle that started with taxing cigarettes, which then produced funds for state governments and the federal government to start these campaigns that made it unpopular and not normal, denormalization campaigns, public awareness campaigns that shifted the image of tobacco and really changed the norms. Next slide. So the whole thing got going when the Surgeon General in 1965 said, hey, maybe this stuff isn't very good for people, and actually came out against tremendous opposition. There are many of these researchers in the tobacco fight and government officials face the same kind of death threats and harassment that we're seeing today in the context of COVID. Next slide. And this gives you a sense of the power of the monetary power. So again, going back to that imbalanced political arena, when you can get taxes, government officials are now in a position where they can fight back against the industry. They have resources. And so you can see some of these taxes, $2 per pack in Hawaii, all the way up in some states to like Washington, $4 on a pack of cigarettes. And you can imagine why most smokers today say they wish they could quit. Next slide. then this is just an example of if you ever want to go online, look at the CDC website, they have a whole archive of these ads that were put out using tax dollars to denormalize tobacco and to help people understand that it's an addictive product and that it's a terrible thing to be a smoker when it comes to your health. Next slide. We're doing some very, very similar strategies at UCSF to fight back against hyper-processed food and beverage. This is just one slide. This is Canzilla, part of the UCSF Bigger Picture Project, and they go around to schools and they do these big public awareness campaigns. They've got really great poets, youth poets and rappers who do videos and try to do outreach into communities of color in particular to help kids, to help denormalize some of these hyper-processed food products with our next generation. Next slide. And the cycle is also underway with this. This is a map of sugary beverage taxes in the United States. They're all happening at the local level in cities because we can't get traction nationally. The industry is just too powerful and it has its hooks in lobbyists in Congress. But you might notice that there's this little cluster of soda taxes in the Bay Area. And that part of that has to do with the UCSF Clinical and Translational Sciences Institute that has really led the charge in bringing scientists to the table to work with local city policymakers to launch our soda taxes in the United States. I had the privilege of working with San Francisco lawmakers to get our tax off the ground. And that tax today is putting millions of dollars back into the community to do chronic disease prevention and also deal with food insecurity during the COVID crisis. Next slide. And then here's what we've got going on worldwide. We've got almost 40 countries with taxes. And again, a lot of scientists like myself have worked with lawmakers in South Africa, India, and other places to bring evidence to the table and help them fight misinformation coming from the industry side of things. As you can see, we don't have a soda tax. We only have city soda taxes in the US, but internationally we've got nation states that are taxing a lot of them because they're concerned about the export of US-based companies trying to push and market unhealthy products on their populations. Next slide. And this is showing you one of the newest innovations in food policy, front of package labels, which are really taking off as nation state policies in Latin America. And my lab in particular is studying the process of diffusion of front of package labeling. These are warning labels that they put right on the front of junk food. And it'll say, go, slow down, don't buy this, don't give this to your kid, you know, and they're on the front of the package. And so, and studies coming out of Chile have shown that they're very effective in helping parents to navigate the grocery store and make good choices for their kids. And we're studying a little bit about this. Next slide. I'll show you a little bit about what we found. You're going to have to click through. My colleagues Angie Carrido and Eric Crosby and I have been studying the diffusion of front of package labeling around Latin America, and currently Mexico is trying to roll out one of these policies, and the industry is playing hardball with that government, threatening to sue through the World Trade Organization. So this is where these companies really can leverage a lot of power because they go to these institutions of global governance and try to pressure nation states to back down on their policies. Fortunately, Mexico is holding tight with their front of package labeling law. They've gone to this is a unit codex within the World Health Organization and United Nations. which sets international standards. The companies are claiming that Mexico is in violation of these standards. And they even got into the renegotiation of the NAFTA treaty, the USMCA. They had their lobbyists secretly writing legislation into the USMCA that would have made it impossible for Mexico to implement its front of package labeling law. Fortunately, somebody leaked those documents to the New York Times, and that little provision got taken out of the treaty. Next slide. So just to wrap up, there's this really cool emerging area that we call commercial determinants of health. And UCSF has really been at the front edge of this, the evolution of this approach. We're home to a big digital archive of internal industry documents on the pharmaceutical companies, on the chemical corporations, on the food and beverage industry, and also now on fossil fuels, all leveraging what we learned through the use of industry documents to study the tobacco industry. And this is the industry documents library is available to anybody on the planet just through the click, and you can search documents between health harming industry executives. And we're studying the relationships between these industries, between chemicals, food, tobacco, fossil fuels, trying to really understand from an integrated standpoint what's going on as climate change and many health issues, trends, they cross-cut various industries. So this is a really interesting emerging field in global health, really trying to think about industry as a vector of disease. If you were trying to understand malaria transmission, you'd go to where the puddles are and the mosquitoes are breeding, and you try to understand, okay, here's the vector of disease. Where are the kids that need mosquito nets at night? And so it's the same principle. We want to study, understand, and monitor that vector so that we can do the right thing for public health. And so with that, I will welcome questions, and thanks so much for your interest in global health sciences.
All right, yeah, at this time, feel free to submit any questions via the Q&A function. It can be about Dr. Schmidt's lecture, the program, or admissions. While we're waiting on questions, do you mind if I ask one?
Go for it, Brett.
All right, if you could kind of give us a brief synopsis of what you would say the biggest challenges you face trying to turn evidence into actual policy change, what would you say those challenges are?
It's a really good question. It's certainly not getting access to people who want this information. It's very easy to approach a decision maker and say, hey, here's an evidence brief. And they're typically, in my experience, really interested in what you have to say. The challenge is helping legislators get policies through committees or onto ballots and getting a fair fight in an election. And that has to do with the money people in my world sometimes say that the best health policy would be a campaign finance reform law in the US. And that's because some folks in the political arena are bought out by these companies, and nothing you say to them will matter. Their political fortunes lie with the donations from these companies, and that's not going to, so it's a form of corruption, in my opinion. And even though in the United States, a lot of this activity is legal, I think it's corrupt. But that's the biggest barrier.
All right, thank you. So we have some questions through the Q&A. So Leslie asked, for capstones, do professors offer research opportunity to students?
Yes, yes, yes. It's I currently have, I think, 3 folks in our current cohort working with me personally. And what's really fun about it is the student gets kind of integrated into the lab. And so they don't just work with me, they work with the statistician on my team, and they work with somebody who was in the program 2 years ago and is now a research associate. And they work with all of the, because at UCSF, we really take team science seriously, and we work in small interdisciplinary teams typically, especially in global health. And so you get you get one-on-one mentoring with your capstone advisor, who's a faculty member. And often, like right now, one of my students is working on water scarcity and beverage corporations in Mexico. And she has on the team a political scientist who's a colleague of mine who I collaborate with at University of Nevada, and someone in Mexico who has done key informant interviews with stakeholders. The beverage companies are running around trying to buy up and privatize public water supplies. It's a very big public health issue with climate change. And so she gets to work with me, she gets to work with someone in Mexico, she gets to work with a colleague in Nevada. It's a really wonderful, I think, exposure to how science actually gets done these days. And it's all about teamwork.
Awesome. Our next question, someone asked, do you have any thoughts about why so many other countries have been able to make laws against health risks when the US has not? Are there any lessons from other countries?
Oh yes, and that is such a good question. The companies come from here. In a lot of these cases, that first slide that I showed with, if you look at those companies, Coca-Cola, PepsiCo, Kraft, in the tobacco world, it's, British tobacco is a really bad actor on the global stage, but we've got Philip Morris and R.J. Reynolds, and this is true across the board. And our government, particularly right now, isn't doing a good job of regulating. They've deregulated for decades now, and internationally, there's a sort of free market mentality. And so the companies get to do a lot that even when I was first starting out, they were much more regulated. So, and definitely we have so much to learn. If Chile and Mexico hadn't done these innovative policies, they were ground zero for studying whether taxes work with soda or whether front package labeling works. And so we have so much to learn from countries that have been able to innovate.
Great. Feel free to submit any other questions that you may have. In the meantime, I wanted to ask, you mentioned that you've seen some parallels between this work and people's response to COVID and policymakers' responses to COVID. Could you talk a little bit more about that?
Well, for one thing, the kinds of harassment that we're seeing with public health officials around COVID who are trying to do mask mandates and other social distancing regulations are very, very familiar. Most or many people, myself included, in my world have been subject to lots of harassment, very familiar emails and, all manner of requests for your, through Freedom of Information Act for your private email. It goes on and on. So I think, the challenge, that's a fundamental challenge for public health that we're seeking. A lot of it comes down to people thinking about themselves as kind of autonomous individuals who aren't responsible for the others around them. And public health has to always be pushing back and saying, no, actually, your mask matters for people around you. And so I think that we're pushing back against narratives, particularly in the US, that, rugged individualism that are really challenging. And then there's there's some very interesting issues going on right now around chronic disease, diabetes and obesity and COVID. And in some countries that aren't so harshly stigmatizing of people who have obesity or have diabetes, we're seeing that the COVID debate has really been beneficial for obesity prevention and diabetes prevention, that governments have said, oh my gosh, these are risk factors for severe COVID. We better clean up our food supply. We better regulate junk food to protect our population. Unfortunately, in the United States, it's been quite the opposite. A lot of policymakers and people in the public domain have been afraid to link COVID to obesity. And that's been unfortunate, in my opinion.
Great. And another question for you is, if you could give one key takeaway to any of your students that go through this course, or any of the participants today, about the role of policy in global health, what would you tell them?
That no matter where you are and what you do, you can make a difference in policy. And my whole course is about that. If you find yourself in Kenya, working with the health department on your capstone, collecting some data, and you get a moment with somebody in the Ministry of Health, here's what you can do to move policy. Hey, here's what I'm finding out in my research. Here's what you could do. Being prepared to take advantage of any opportunity you have to shift policy. I think a lot of people don't feel empowered. And actually, as researchers, and especially as student researchers, you are in a position where you can really make a difference, because you got no skin in the game, right? You're a researcher, you're coming in and you're saying, hey, here's what I'm finding with my research. It suggests this. And you wouldn't believe, I try in my course to bring in lots of guest speakers from all different walks of life, who become advocates, who become scientists, evidence to policy type scientists, and to really, journalists are often really important. And the great thing about policy is you're not helping people like with clinical work, one person at a time. You're shifting the dial for whole populations of people. And I often say that a lot of my colleagues at UCSF, I call them frustrated doctors. They've been, running the childhood obesity clinic and dealing with one patient at a time, going, this food system is so out of control. The kids can't take my advice. They're being marketed to. And they wind up working with me on policy, because it's such a powerful tool for public health.
Great, thank you. And we got one more question from the participants that says, I was wondering if you could please talk more about UCSF's The Bigger Picture Project and how we can use science-based approaches to denormalize hyper-processed food products.
Great question. So the Bigger Picture Project is a collaboration between UCSF's Center for Vulnerable Populations and a local or California-based organization called Youth Speaks. And what Youth Speaks does is they work with mainly with young people of color from economically disadvantaged backgrounds. And they work with them to become poets and artists. And what UCSF brings to the table is a curriculum teaching young people about the risks, target marketing, food environments, the risk that you have, the disproportionate risk that you have for poor diet, just because of the fact that the color of your skin and where you live, what your zip code is. And then Youth Speaks works to elevate what the thoughts and feelings and experiences of these youth poets through a series of online absolutely spectacular YouTube videos. And you can go online and you can listen to them, and they're absolutely amazing. And one of the founders of Youth Speaks, Dean Schillinger, teaches our non-communicable disease course in our curriculum. And so he's been a big mover and shaker behind that program.
Great. Well, thank you everyone for the questions, and thank you, Dr. Schmidt, for your lecture. I just wanted to remind everyone that the deadline to apply is tonight at midnight, and you can send any questions to the email on the screen, which is that education@globalhealth.ucsf.edu email if you have any questions. Thank you.
Great. Thanks, everybody.